Welcome to this presentation on coronavirus or COVID-19. You know, a couple weeks ago, I didn't even know that I'd be doing a webinar on coronavirus. This is definitely a difficult and historic time that we're living through. So we wanted to make sure that you had some good information on coronavirus. So thank you for your time and attention today. So as you probably know, the information on what they are learning about coronavirus is changing, sometimes hourly, but certainly day by day and week by week. So the information that we're going to talk about today is based on what we know as of March 15th, 2020. And the sources that I use for this information were from very trusted news sources, and I definitely encourage you to get your news from the CDC or the World Health Organization. Also remember your state departments of health and your local public health departments. They are all there to help you through this and give you accurate information. So what is the coronavirus, also called COVID-19? The reason that we're calling it COVID, which is probably what I'm going to be referring to it through the rest of this presentation, is the CO in CO stands for corona, the VI stands for virus, and the D stands for disease, and it was first detected in 2019. So that's where COVID comes from. And the coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. And rarely animal coronaviruses can infect people, and then they can spread between the animal and the people. And that happened with SARS, if you remember the SARS outbreak. The virus that causes COVID-19 is a new coronavirus. It was first identified during an investigation from an outbreak that happened in Wuhan, China, and it has now spread and been detected in more than 100 locations internationally, including the United States. The COVID-19 is a respiratory illness, and it can spread from person to person very easily. It's highly contagious. So currently there's no vaccine to protect us against COVID-19, but they are working on one. In fact, today when I was listening to the news, they started a trial of, I think it was 45 people who are going to try out a new vaccine. But even at that, they are saying a vaccine is like a year away. So the best way to prevent infection is to take the everyday preventative measures that they have been talking about, like avoiding close contact with people who are sick and washing your hands often. And there isn't any specific antiviral treatment for COVID-19. Again, they are working on that. They're trying some current antivirals to see if they're effective. So we'll stay tuned for that. But certainly people with COVID-19 can seek medical care to help relieve symptoms. Currently, 80% of people who have COVID-19 have mild to moderate symptoms. The symptoms can go from feeling like you have a slight cold to having pneumonia. So 80% of those with mild to moderate have recovered with no complications. About 20% have severe symptoms that may require hospitalization. On March 11th of this year, the World Health Organization declared the COVID-19 a pandemic. And a pandemic is when there is a worldwide spread of a new disease. And this is the first pandemic known to be caused by the emergence of a new coronavirus. So one of the things we learned from the outbreak in China is who is at highest risk of being seriously ill if they contract this virus. And It is the older adults, people over age 60, and with each decade as they turn 70 and 80 and 90, they are more and more at risk of becoming seriously ill with this virus. Also, people who have serious chronic medical conditions like heart disease, diabetes, lung disease, if they contract this virus, they may become quite ill. The common symptoms of COVID-19 are a fever, a cough, shortness of breath, and fatigue, and they can appear anywhere from 2 to 14 days after being exposed. These symptoms range from mild to severe. In the severe cases, you may see pneumonia, multiple organ failure, and in rare cases, death. So this virus mainly spreads from an infected person to another person. And it happens through respiratory droplets that are produced when that infected person either coughs or sneezes, and someone close to them, then the droplets land, and they can now take the droplets that have the infected virus and get them into their system. They say that when someone coughs or sneezes, that spray can go up to 6 feet. So when they talk about being in close contact with someone, they say within 6 feet, and that's where they get that. So it is also important to know that people can spread this virus even before they feel sick. So maybe they feel fine and they don't have a fever, but days before their symptoms occur, they can be spreading that virus. So that's what makes it difficult too, because you can stay away from people who are sick, but this may be people who don't even appear to be sick yet, and you could catch that virus. But people are thought to be most contagious when they are symptomatic, when they're the sickest, and certainly that's why they need to stay home. Now, it may also be possible to get the virus by touching a surface or an object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. We are trying to learn a lot more about this disease, and we're still learning about how it spreads, how long the virus could stay on a surface or an object. So hopefully we'll learn more information about that. So it's important that we follow some guidelines on how to protect ourselves from the virus. Certainly the most important way is to hand wash. Hand wash correctly with soap and water for 20 seconds. And soap and water are the preferred choice to clean your hands. It's so important that we do this hand washing, though, in the right way. You want to take that soap and water and really use friction to rub it all around your hands, especially around the nail beds. Do a good job with that, and do it for 20 seconds. However you count that out, or sing happy birthday twice, whatever you do. The important thing about this correct hand washing is that we do it with this soap and water, that we use friction and really rub around our fingers and get them nice and clean, and that we do it for the length of time, which is 20 seconds. If you can't use soap and water, or you're out and about, you can certainly use an alcohol-based hand sanitizer. Just make sure that it contains at least 60% of alcohol, because that's going to be what it takes to kill the viruses. You want to avoid touching your eyes, your nose, and your mouth with unwashed hands. This is a hard habit to break. I was paying attention once to how often I, don't even think about it and touch my hands to my face. It's a habit I'm trying to break. I think it's a habit that we all have to start paying attention to, and try to do that, because your hands, if they're not washed and they have the virus, and you bring them up to your eyes or your nose or your mouth, you're now potentially introducing that virus into your system. Be sure to cover your cough or your sneeze with a tissue, or if you don't have a tissue and suddenly you're going to cough or sneeze, cough into your elbow. If you do use a tissue, it's important that that contaminated tissue is thrown into the proper waste facility. Best to have a covered bin so that it can't contaminate anyone. You want to clean and disinfect your frequently touched objects, doorknobs and handles and back of the chair, those kind of things. Most of the common EPA registered household disinfectants are going to work. So just use that, whatever is appropriate for the surface. And then lastly, you don't need to wear a mask if you're not sick. Wearing the face mask is for people who are sick. And basically they should be wearing it when they're going to the doctor. Because if you're sick, you shouldn't be out and about. So wear the face mask if you're going to the doctor. But the mask is not going to protect you from getting the virus. The surgical masks that people wear, they're not closed all the way. They certainly would allow respiratory droplets to get in. Also, if you've ever worn a mask, you know how often you're bringing your hands up to that mask to try to reposition it, because they're not that comfortable and people are always touching their face and moving that mask. So again, masks are for those who are sick. More protection and prevention tips. You really want to try to avoid touching high-touch surfaces in public places. Things like your elevator buttons, door handles, handrails. You don't want to shake hands with people. You really need to try to use your tissue or your sleeve to cover your hand or your finger if you have to touch something. You get into an elevator, how are you going to touch that button? We have to all start thinking about that. What do we use to do that? And they talk a lot about social distancing, and this is very important. You want to avoid being close with people who are sick. And remember, they may not even feel sick yet. So it's important that we avoid big gatherings, that we maintain a distance when we are out in public of approximately 6 feet. Again, remember, because if they cough or sneeze, that spray could go 6 feet. Don't shake hands. You want to learn to nod or wave at people, and that can be a hard habit to break, but I think we're all in that mode now. So why are we doing all this social distancing? You see places closing, schools closing, all of this is going on. It's because we're trying to avoid contact with others and not go to the medical facilities, because we don't want to overwhelm our healthcare systems. We want to make sure that these facilities are there to operate effectively and efficiently, to care for all the people who have not just the COVID-19, but other viruses and other healthcare medical needs. So what should you do if you start to feel sick and think, I have symptoms, the shortness of breath, the fever, the cough, and could this be COVID-19? Well, stay home and call your doctor. Your doctor is going to advise you on your next steps. You want to make sure that you never just show up at the clinic, thinking you need this COVID-19 test. They definitely want you to call ahead and then follow their recommendations. If you do have to go see the doctor, you want to wear a mask when you're traveling to prevent other people from, catching the virus if indeed you do have that. So that's when you would want to wear a mask. You want to make sure you're washing your hands often with soap and water, and cleaning and disinfecting the frequently touched objects in your home. But what if you become sick while you're at work? If you're at a client's home and you start to feel sick, we want you to stop work immediately. Put on a mask or something to cover your mouth and go straight home after you've notified your visiting angel supervisor. And what should you do if you're working with a client and they're showing some symptoms of acute respiratory illness, the cough, the fever, difficulty breathing? You want to notify your supervisor immediately, and then they're going to give you the recommended advice. The CDC has provided tips on what people should do if they become sick. And so if your families would ever ask you, what should we do if they are caring for a loved one that has confirmed COVID virus, these instructions on how to care for someone who's ill from the CDC can be downloaded and printed off, and your supervisors can help you with that. The coronavirus is causing a lot of understandable stress and changes in our lives. And we all have to work on managing our stress and anxiety. So what can we do to help take care of ourselves? Well, definitely take a break from watching and reading or listening to the stories about COVID-19. Sometimes if you just bombard yourself and overwhelm yourself with all this information, it can be too much, and you need to just turn the TV off or watch a movie or do something different. Take good care of yourself physically. Stretch, meditate. You can still go outside and take a walk. You want to distance yourself from people, but you're still able to go outside. Eat healthy, eat well. It's so important to get sleep, and avoid any alcohol or drugs. That is not going to support you or get you through this or really help your anxiety during this time. So try to find some activities that you enjoy to take your mind off it as a distraction. And you can still connect with others by calling, by Skype, or FaceTime, talking with other people and sharing how you're doing. This is also a time that could make your client feel very anxious too, with everything that's going on. And we really want to take a look at what we're learning about COVID-19 and in general infection control, and remind ourselves that this is again a good opportunity to remember how important overall health hygiene is, infection control, and what we can always do to limit the spread of any infectious disease, not just COVID-19, but any disease. And know that your calm presence and modeling of good infection control practices, as they see you washing your hands really well and wiping down surfaces and doing all those good things, it's really going to give them confidence and help them control their anxiety over this virus. And just like yourself, you want to maybe offer some breaks from the news and the media on this virus. Find out what else they like to do. Take the time to do something other than watch the news on this or talk about that. When I think about coping skills, coping with fears and anxiety, you may have skills that have gotten you through other adversities in life, and you want to draw on those skills to help manage your emotions during this challenging time. And I find that especially with our elderly, chances are they have lived through some really difficult times, and they are very resilient, and they may want to share some of those stories. I was talking with an elderly couple that I take care of, and they were talking about things like how they lived through the polio virus, and how they lived through the Great Depression and World War II. And I was even talking about the toilet paper running low, and then they showed me an old book of rationing tickets and talked about how they had to ration supplies. And I found that they enjoyed talking about the things in their lives, the reminiscing of the difficult times they had lived through, and I praised them for the resilience and what they got through. And I actually felt better because it kind of made me feel hopeful, and I realized that a lot of generations have gone through things, and we will come through this, and we will learn good lessons through this. So if they are someone who wants to share some of those stories, this might be a good time to listen to those. Listen and learn. So as a reminder, of course, wash those hands. Wash them a lot. Stay home if you're sick. Avoid close contact with people. And stay informed in moderation by using a trusted news source. And as we close this presentation, we're going to listen to a video from the CDC on hand washing. Thank you so much for your time and attention. Stay happy, stay healthy, and take care.